Hello, I'm Kristina Whitworth from the University of Texas School of Public Health. I'm an assistant professor at the Southwest Center for Occupational and Environmental Health and in the Department of Epidemiology, Human Genetics, and Environmental Sciences. Along with colleagues at the National Institute for Environmental Health Sciences and the Norwegian Institute of Public Health, I conducted a study to assess the association between plasma concentrations of perfluorooctane sulfonamide, or PFOSA, and time to pregnancy among Primiparous women. PFOSA is a perfluoroalkyl substance, or PFAS, a class of persistent synthetic compounds often used in industrial and consumer products. Although the use of these substances has been phased out in many countries, exposure is ongoing and potential risks, including decreased fecundability, are still of concern. Although several studies have examined the association between fecundability and the more common of these substances, PFOA and PFOS, few data exist regarding the potential relation between PFOSA and fecundability. However, recently, two prospective studies have reported conflicting evidence regarding the association. Of particular interest in the relation between perfluoroalkyl substances and time to pregnancy are the pharmacokinetics of these substances during pregnancy and during lactation, as well as the potential for the recency of the most previous pregnancy to affect PFAS body burden. This figure illustrates the potential for reverse causality between PFAS concentrations and time to pregnancy among women in retrospective studies. Based on previous data, we anticipate that women's PFAS body burden will decrease after delivery of their child and after lactation, and then rise again to some baseline level. Therefore, long intervals between the previous pregnancy and the current conception, and therefore longer times to pregnancy, allow more time for PFAS blood concentrations to rise to the pre-pregnancy level, potentially resulting in reverse causality of the association between PFAS concentrations and time to pregnancy. This phenomenon, however, is not an issue among women who have not had a previous pregnancy. Therefore, we conducted a study among a subset of 451 women from the Norwegian Mother and Child Cohort Study, or MOBA, who had not previously given birth. In MOBA, women were enrolled around the 17th week of pregnancy and asked to recall their time to pregnancy. During this baseline interview, plasma samples were also collected and analyzed for PFAS concentrations. Although the adjusted fecundability odds ratio indicated 9% decreased odds of conception in a given month per interquartile increase in PFOSA concentrations, the 95% confidence interval ranged from 0.71 to 1.17. We also did not observe evidence of an association between other PFAS compounds and fecundability. In summary, our results are not supportive of an association between PFAS concentrations and decreased fecundability.